Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I am Gail Demori, Madam Chair, and with me are Vice Chair Mary Beth Welch and board members Dr. Ed Weiner, Andrea Sheehan, and Dr. Marwa El-Sahabi. In addition, our professional staff we have here alongside with us is Susan Luminello, Director of Public Health, and Michael Green, Associate Director of Public Health. And we're recording for Julie, is that right?
Yep.
Okay,
Julie.
great. And our recording secretary, Ms. Fockingham, will be taking care of our minutes. Thank you for all that you do. Please note we are on live and will be taped by BCAT and are available for appropriate comments and questions through this technology. Thank you to BCAT for what and all you do for this community, which is keeping us so well informed. Is there anyone, no one's here for citizens' time, or is there? It looks like
There is
someone's online.
Yes, Ruth. Just
And we have people in the audience, but you're on the agenda. Ruth, are you here to talk to the Board of Health?
she's on mute right now. I'll message her.
Okay. We just have to check and see if she's here for citizens' time. Oh, is she gone?
Oh, she hung up, yeah.
It looks like no one is here, so I'll go into Chairman's report. Just a quick little excitement. Fall is really settling in, especially with Halloween being here on Friday night at the end of the week. Without taking all the fun and excitement of Halloween, I thought it may be a good time to remind residents to be super aware of extra kids who may be out and about this Friday night so we can all have a safe and happy Halloween. For the drivers out there, stay alert for darting children who are excited about getting to their next stop to check out the decorations and collect their treats. And for the trick-or-treaters, it's important to keep in mind that safety on Halloween comes down to how visible you are to the drivers. So for those who are out and about, please think about taking along flashlights, glow sticks, and stay on the sidewalks and in groups to remain visible to all drivers who are out there. With that said, I'm moving on to our subcommittee reports, which we have one. Dr. Marwa El-Sahabi is going to give us an update in public health.
Thank you, Madam Chair. So I'm just going to address the big elephant in the room, which is menopause tonight, because even as a kidney doctor, I get a lot of questions about this. And so this goes out to all the women in the town and other towns who may have questions about this. So the most common menopausal symptom is hot flashes, one of the worst. And, this can start like a year before you actually enter menopause, and it can happen for like a decade or more after, so it's quite miserable. There are medications, such as certain antidepressants, that actually work well for these symptoms, but again, you have to ask your health provider if that's right for you. Again, try and avoid triggers, so things like alcohol, caffeine, stress, which is easier said than done. Some people wear layers so they can delayer, carry around a fan, drink a lot of cold water, but it is cumbersome. And it may also add to sleeping problems, which are another big issue for menopausal females. Hot flashes, low estrogen can keep you up at night. And on top of that, it's just hard because it just becomes harder to fall asleep and stay asleep. So exercising during the day, like earlier in the day and not at bedtime, is very, very helpful. Things like stretching and yoga. Healthy eating habits, drinking plenty of fluids, that type of thing. The other thing that's very common is depression and anxiety. It's something we do need to talk about. It's fine to talk about it. You should talk about it with your healthcare providers. There are medicines for this, and if you don't want to take a medication, again, keeping physically active can help with that, and it can actually help to delay the onset of memory loss, which is another issue that can arise with menopause. can also delay the onset of dementia in older women. So getting plenty of vitamin D and calcium, if you are directed to do so by your physician, is also important. But again, I'm going to stress the physical exercise because as we all get older, that's important for our bone strength, not just to prevent muscle loss and what we call sarcopenia. And it's also very important to get enough sleep, like 7 to 9 hours a night. And healthy eating habits include eating a lot of fresh vegetables like fibers, getting a lot of lean protein like cottage cheese and Greek yogurt, fish, that type of thing. But again, it's all very important for preventing memory loss, for handling mood swings, and for keeping your balance intact and your strength intact as you get older, which prevents falling and then preserves your independence. So all of this kind of ties in together. But again, if you have very specific questions, you should go back to your healthcare provider. Thank you.
Great, thank you.
Wonderful. Thank you.
So we have a hearing on the agenda. Keeping of animals, hens at 1 Liberty Ave. We were looking for evidence of pest control plan, schedule, receipts, and reports. Do you want to come up and sign in and kind of give us an update? And could you remind us of your name?
Warren Chia and Lynn Chia.
Right, thank you.
Hi, everyone. Yeah, so a quick update on vendor selection. We have entered into a contract with a vendor called NW Pest Control. This is different from what we had proposed last week. It's actually a pricier option because this vendor had this additional service where they can come and gas the burrows right up front. The other company that we were talking to didn't have that option. So we signed with them and we started last week. This is a full 1-year term. It's not like a 6 to 9 months. It's like 1 year. And we're spending a little over $2,000 out of pocket to get this going. So we initiated last week. They came, they gassed the burrows. Basically what they do is I don't know if you guys are familiar with the process, but they gas the burrows, they kind of cover up the holes, and then the expectation is that if rodents that are home will die immediately. And then they came back this week to check on where the holes were. Some holes had opened back up, but definitely fewer than before. They repeated the process. It's like standard to have one follow-up visit for that. And the technician also said that even though there weren't kind of reopened burrow holes, the activity was very minimal. He didn't see any, for example, he didn't see any rat droppings and things like that. Mm-hmm. So I think, yeah, it's encouraging. We are now shifting to they also set up not traps, but bait stations last week when they were here. So we're kind of transitioning into the bait station part of the program, and they'll be back at least monthly to check on the bait stations.
Great. Does anyone have any questions or?
Oh, very responsible. Thank you so much.
Thank you for doing that.
No problem.
I think it's important to stay due diligent just to make sure it's under control. It sounds like you're getting it under control, and then hopefully by the spring they'll be gone. And it should be, hopefully, fingers crossed, all taken care of. Do we need to do?
Yeah, I just have one.
Okay, yes.
So you said you have the contract for a year. So how often will they be coming out, and how often can we expect a report from them? Do you know?
It's called bi-monthly, but when I spoke to the technician today, he said we'll probably come out on average like once a month.
Once a month. So you
Yeah.
get a report once a month?
Yeah, I don't know exactly. My understanding is it's more recent, it's more frequent in the beginning.
Okay.
And then they kind of settle, maybe by, the second half of the program, they settled into bi-monthly, which I think of as once every 2 months. So maybe across all those visits, it averages out to once a month.
Okay.
I'm not 100% sure,
Yeah.
to be honest.
And
Okay.
just a reminder to send those along
Yep.
to Marlene when you get them. And probably within that time period, too, she asked me to just let you know that we'll probably come out and do like an unannounced type of inspection. So we wanted to get an idea of like when a good time for that would be. If you want to think about it, you can email her and let her know,
Okay.
this is, I don't know, Mondays, nights are good, or whatever works for you.
Okay, yeah, we'll let her know.
Yeah.
Do you have any questions or
Other
comments?
questions? The chickens are laying eggs.
Yeah, slowing down a little bit
Chickens have not
because it's getting cold,
affected.
but
Yeah.
yeah.
Good, thank you.
Okay. Anything else? We're not voting on this, are we?
No.
No, so that's it. Thank you for doing your due diligence, and we'll just keep and check with Marlene through the reports that you get.
Sounds good.
All right?
Thank you.
That's great. Thank you so much
Thank
for
you
your
so
time.
much.
So this is just going to bring us to our staff reports, which I'm looking at, Christine Mathis is not here, but she's on the agenda, so do we need a motion to save that for carry it to next meeting?
We can,
Do we have to vote on that?
Do, or I can try to answer the questions.
Does anyone, or should we just do it now?
we can just thanks.
Okay. Does anyone have any questions about Christine's report? I didn't see anything that I was questioning.
Well, the question I had was the Prestige Car Wash.
Oh,
Did they come back? Are they coming back?
We haven't heard back from them, so I don't think so. I don't even think last I had asked Christine, they weren't on the Concom's agenda either, so.
Either. And then Takeda is leaving town.
Takeda.
Cater?
Takeda. Really?
Takeda.
Yeah.
Oh, Takeda. Yeah.
Takeda.
Yeah.
Takeda Pharmaceuticals.
Yeah, yeah.
Were they just a clean room, or was that an actual?
They had a permit, a biosafety permit.
Yeah, but for what? Was that part of one of the large groups within a single building, or do you know?
I don't know. Do you know
Believe
that?
it was.
Yeah.
Okay, thank you.
Just curious, was it, because they were pretty excited to be in the community, just,
I think when they cut the federal funding,
yeah.
that's when a lot of
so
the
that's a result of
pharmacies
that, okay.
took a hit.
Do we have to close out that permit
Christine,
upon their leaving?
yeah, she'll make sure that
Okay.
everything is, out of the building, and then anybody else could move in after them.
But they'd have to get a permit for theirs.
If it is.
Right, something of that nature.
Permit is needed.
Okay. All right. Anything else? I need a motion to approve Christine Mathis.
Second.
All in favor?
Aye.
Great. Associate Director, Public Health, Michael Green.
Yeah, thank you,
overview.
Mr. Chair. Just reporting that we are almost done with our flu clinic. We got one more left for employees tomorrow night. I think we got 37 shots left, and it looks like we'll either get rid of all of them, or at least enough to get to our threshold, so we won't be, or we'll be reimbursed for any that remain.
Great.
So
That's
it was a good
exciting.
season.
Madam Chair, I was just curious, you just said something like back, how was the attendance this year?
It was good. We were able to get rid of, or give 150 high dose, and we have 37 of 250 regular dose.
Because this year we decreased, from last year's discussion. Okay.
We did. So we'll be looking at next year's projected numbers soon, just to get a feel for what we think
Right.
we might actually up the number of high dose,
I was
because there
gonna
seemed to
say,
be quite a bit
Right.
of demand for that, and maybe stay even with the regular dose. So I'll be consulting with our public health nurse on that, and
That
Susan.
makes sense, I think.
Great.
Motion to approve the Associate Director of Public Health report.
Motion to approve.
Second.
All in favor?
Aye.
Aye. Great. And moving on to the Director of Public Health, Ms. Susan Luminello, to include the supervisory nurse, Sandra Troiani's report, as well as Marlene Johnson's
And the Associate Health
Associate Health
Agent,
Agent,
Samantha.
oh, Samantha Ellsworth as well. Sorry, I missed that.
So in the office, Jennifer Walsh started as a part-time admin. They're finishing up the food permits now. They all expire November 1st. We have about 10 to 15 left. So we may need, we're scheduled to go out Monday for anyone who hasn't renewed their permit and just close them for operating without a permit. So we're hoping we don't have to do that, and they'll get it all, everyone will get it in by Monday, but we'll see. So, but we're prepared to do that. We're continuing to interview for the epidemiologist and the health communication specialist position. We're on second interviews now. Thank you to Mike and Katie Capabianco, because they've been sitting in on all these interviews. We got a lot of applicants, especially for the epidemiologist position. It's been quite a while to go through them all. We just posted the health inspector position today, which is a part-time position. Again, I think I mentioned it before, but that was requested by Lexington because their health inspector is going to be on maternity leave for a while, and Taisha has been doing inspections for both us and for them. So she's in Lexington for a day and a half. She's also doing the tobacco compliance, so she does all the compliance checks and the tobacco retail inspections as well. So she's pretty busy, so I think we'll be able to keep the new health inspector busy too.
Any questions?
Yeah, I have two. Susan, what's a little bit more, I can read that numerous residents along the Daniel Drive, that,
Yeah.
is there a reason that area that's happened, like, sounds like?
Well, I can't say what the reason is, but, this has been going on for quite a while. It's been
Okay.
weeks that we've been working on this complaint, and this, we've had calls from several residents along Daniel Drive, so it's been quite a while. And when we first started looking into it, residents were saying, it was the trash, the dumpsters on the Lord Barron property. So there was some issues there when we first got there. There was trash on the ground, and they were leaving the covers and the doors open to the dumpsters. They've been pretty compliant now for quite a few weeks, and they've also got pest control along the fence line, because it seems to be in one area of the fence line there. And the residents have also done their part. They've gotten pest control if they have it on their property, because everybody has to, and they have to make sure they have no compost, out, or that they have, their bird feeders are in, and no food is left out, that type of thing, and then their trash is all secured along that area. So they're trying to work together to kind of solve the problem. It's improving based on the pest reports that Lord Barron is giving us, so they're providing the reports to us, and their pest control goes out and checks the bait boxes. So they'll report, light activity, medium, heavy activity. So the heavy activity seems to be still focused in one area now, but Taisha's been going out there on a regular basis, checking all the dumpsters in the area, not just Lord Barron, but any dumpsters that are in that area. And they've looked good so far.
Thank you. So they're doing it. No, that's good. I didn't know what the pest control team was and how many times they're going out, but if you're getting reports, then...
Yeah, they're sending us, of course, the neighbors aren't sending us their reports.
No,
just
obviously. All right, and then can you give a little bit more detail? What is that needle stick injury?
So that happened at the flu clinic. We had a nurse who got a needle stick injury. We followed our protocols, and we were able to pinpoint the resident who was getting the vaccine at the time. And, I called them up and asked them if they were willing to get, because the nurse asked us to do that, if they were willing to get tested or whatever. And they said they'd think about it. They haven't got back to me yet. So the nurse is going to follow the protocols that her doctor has given her for that.
Thank you.
Anyone else have questions? Or I was just curious about the yellow fever vaccination inquiry with Sandra's report. Do you know? Was it an inquiry or someone was traveling, or, I thought it was odd.
I would guess that that's probably a
Okay.
travel-related
Okay.
one, yeah.
I thought it was odd,
Nothing in
yeah.
Haven or anything like that. That was probably just a resident calling and asking the question.
Okay, wondering about, okay.
And that-
Doesn't sound like something we would.
I know, I was like, this is so out of the ordinary.
And
I
that's,
know.
and that's a big deal, because in
Yeah.
many
It is a big
places,
deal.
you have to have
Certain things.
a yellow fever card.
Oh, okay, I didn't know
So,
that.
oh, yes, so
So that's good to know.
referred to travel clinic.
Yeah.
Yeah,
Big deal.
very good. I'll take a motion to approve the,
Health-
sorry, I didn't write it, the health agent report, the associate health agent, and the supervising nurse reports.
And
Oh, as well as Susan Luminella's Director of Public Health report. That's a
So
mouthful.
moved.
Second.
All in favor?
Aye.
Aye. Great. Motion to close the meeting.
motion to adjourn.
All right, you win.
Second.
Like, this is the
I think
fastest
Jill and
meeting.
all
I
the
think
others,
that's-
this is the fastest one.
Very good.
All right, good. Well,
Good night,
thank you.
everybody.
Good night.
Guys.